All right. Good afternoon, everyone. My name is Elisha Kelvin Raj, Executive Director of Gen Connect Malaysia and proposer of GenBridge 360. For today, I will also be serving as the facilitator for this negotiation. Now, before we begin, I'd like us to go around with brief introductions so everyone is clear on who is at the table. Please share your name, your position, and the company you are representing, as this will help set a solid foundation for our discussions. Let's start with Nitya, then move on to Diana, and finally Lukman.
Good afternoon, everyone. I am Nitya Rupini Ashokumaran, Community Nutrition Leader at NutriCare Biofood Industries, Sdn Bhd. Thank you for having me on this wonderful day.
Thank you, Alicia. Hello, everyone. My name is Nurudiana binti Sesi Burhan. I am the Chief Executive Officer of Mind Body Shine Nutrition Sdn Bhd. So our company focusing on improving mental health and well-being through counseling and community support. So I am happy to be here today to share more about what we do.
Hello everyone, my name is Lukman Hakim bin Munasir and I serve as the Program Director of Active Aging Network Sdn Bhd. It's an honor to be here today to share our vision for healthier and more connected communities.
Welcome, everyone. Now let's get right into the negotiation. The Ministry of Health has provided a limited budget. Only one proposal can be funded this round. That means our task for today is not only to present, but also to negotiate fairly, professionally, and assertively. We will proceed in this order. Each of us present our proposal. Then we compare ideas, explore collaboration, negotiate priorities, and finally decide on the way forward. I encourage everyone to be open, respectful, and be willing to compromise. This isn't just about winning. It's about creating the strongest solution for Malaysia. Now, let us begin. I now invite Nitya from NutriCare to present a proposal.
Thank you, Alicia. I'm excited to share my proposal with all of you. NutriCare. What is NutriCare? Providing nutrition meals and diet education in hospitals. The problem is clear. Hospital meals are often generic and not suitable for patient recovery. At the same time, healthcare staff working long shifts rely on junk food or rather quick snacks. This slow recovery, reduce energy, and increase cost. NutriCare's solution is simple: provide dietitian approved meal daily for patients and staff, organize weekly nutrition workshops, and station on-site dietitian to guide recovery and health. We are requesting RM 1 million. My message is simple. Food is medicine. Without proper nutrition, patients take longer to heal, staff lose energy, and the system pays more. Thank you.
Thank you, Nitya. That was a very clear presentation. However, may I ask, how do you plan to keep meals affordable without compromising nutrition, especially since hospitals cater to a wide range of patients and staff with different needs?
That's great question, Alicia. We believe that healthy meals can be both affordable and sustainable through a combination of smart sourcing and efficient operation. By partnering with local farmers and purchasing ingredients in bulk, we're able to reduce costs while supporting the local economy and ensuring fresher, high quality produce. We also minimize food waste through portion control, carefully analyzing consumption trends to serve the right amount of food without excess, which help lower costs and support sustainability. Additionally, we rotate our menu seasonal, which allow us to use ingredients that are more abundant and cost effective at different times of the year. This is not only enhance flavor and freshness but also help us maintain competitive pricing. Altogether, these strategies enable us to offer nutritious, satisfying meals that accessible without compromising on quality or other value.
I agree with Nitya. Nutrition is important for patient care, but it can be affected if patients don't eat because of stress or depression. That's why a mental health support is also essential in the treatment.
True, but I also appreciate your focus on staff. Too often, their well-being is overlooked. I have seen nurses running entire shifts on just snacks or skipping meals altogether because they are stretched so thin. It is not just unhealthy, it will also affect energy, focus, and even patient care. If we care for the caregivers with proper support and wellness, they can care better for everyone else.
You all make excellent points. You've highlighted how nutrition, mental health, and staff well being are all closely connected, showing the bigger picture of patient care. On that note, let's now move on to Diana to share her proposal.
Thank you, Alicia. Hello, everyone. Now, let me brief our proposal. Our proposal is our Fit Health and Mental Wellness Program. Nowadays, Malaysia is facing a mental health crisis like depression, stress, burnout are increasing among patients, staff, and family. Yet, mental health is still often overlooked. So, our Fit solution include on-site counseling, stress management workshop, peer support group, and also 24 hours helpline. So we are requesting 1.3 million as professional therapy and crisis support require proper funding. So the message is clear. Mental health well-being is key to physical health. Without emotional strength, even the best medical treatment may not be effective.
Thank you, Diana, for the insightful presentation. Mental health often feels intangible, but it has such a direct impact on recovery. Could you share a real example where mental health support made a tangible difference in a patient's treatment or overall recovery process?
Sure, Alicia. Let me share a few real situations. A cancer patient, in example, I worked with before. She refused food and skipped medication. Once counseling was introduced, she regained appetite, adhered to treatment, and improved remarkable. I also supported a stroke survivor who was extremely frustrated by memory loss and speech difficulties. She became angry during therapy and refused to participate. So, a mental health intervention helped her process grief, set small to achievable goal. So, with ongoing psychological support, she developed a coping strategy and re-engaged with her therapy plan. So it completely changed her recovery path. So that is the power of mental health support.
That story is powerful. I see now why mental health must go hand in hand with nutrition.
And for staff too, I have watched colleagues leave the profession due to burnout. With the right support system in place, many of them could have stayed and continue contributing their skills and passion.
Those are all very valuable points. Diana's example shows the link between emotional well being and recovery. Nitya has connected it to nutrition, and Lukman has highlighted the reality for staff. Together, I can see it paints a fuller picture of how health must be addressed holistically. With that in mind, let's now move on to Lukman to hear his proposal.
Okay, thank you, Elisha. Okay, our proposal is GenFit. It is an inclusive wellness for all generations. Malaysia's problem is physical inactivity. 1 in 2 Malaysians does not exercise enough. This causes obesity, diabetes, and heart disease. Hospitals are now overwhelmed. GenFit solution goes beyond exercise. It is about creating a healthier culture we will establish fitness zone in 3 pilot communities designed as safe, accessible spaces where people of all ages can gather. These zones will host guided programs tailored to different groups. It is fun, it is also play-based activities for children to build lifelong habits, and it also structured fitness and stress relief sessions for working adults. And gentle movement classes for seniors to stay active and connected. To ensure the program lasts, we will train community volunteers as facilitators and motivators. So the initiative is not just a project, but a movement that sustains itself. We are requesting RM 1 million to make this initiative a reality. So our message is simple. It is cheaper to sweat today than to pay hospital bills tomorrow. Because prevention is the smarter, the healthier, and more sustainable choice. Thank you.
Thank you, Lukman. That was a strong presentation. Let me ask though, how will you ensure that people actually use these fitness zones instead of them becoming underutilized spaces or empty playgrounds?
That's a good question. That is why we will have trainers and community volunteers leading regular activities, from Zumba and yoga to fun kids games. When fitness becomes enjoyable and social, people naturally will show up. This is about building a culture of wellness, not just providing infrastructure.
Yes, I agree with Lukman's points. Social connection play a key role in motivating participants. When people feel supported and connected to others, they are more likely to engage actively and stay committed to the program. Building a sense of community not only improve mental well-being but also encourage sustained involvement and better outcome.
And exercise complement good nutrition, isn't it? A nature partnership which emphasizes that exercise and nutrition are not separate efforts, but two interconnected pillars of a healthy lifestyle. When communities are encouraged to move more and eat well, the benefit multiply, which are improved energy, better moods, stronger immunity, and reduced risk of chronic disease.
Excellent points. Together, you've shown that fitness, nutrition, and mental health work best when connected, a synergy that leads to a holistic solution. With that, I'd now like to present Gender 360. Malaysia faces another challenge: isolation between generations. Seniors feel lonely, youth are disengaged, and adults are stressed. These are all some of the causes which actually weakens health and communities. However, Jambridge 360 is here to save the day. Jambridge 360 provides mentorship circles, storytelling sessions, wellness workshops, and community gardens where generations learn and grow together. We are requesting a fund of 980,000 ringgit in total, the lowest among our proposals. My message is clear. We don't just treat individuals, we strengthen communities. Thank you.
I love the intergeneration idea, Alicia. I would prefer food traditional can be shared that too.
Yeah, if you all know, sharing stories can support mental healing. So when people share their experience, it help them feel understood and less alone. So community care creates a safe space where people can connect, which reduces feelings of loneliness and builds stronger support for everyone mental health.
Yes, and physical activities can be built into these sessions. For example, like exercises, morning walks, or even simple stretching can be done together across generations. It doesn't have to be intense. The point is to move, connect, and stay healthy as a group.
Thank you all for your strong pitches. Excellent work. Now, let's take some time to compare in detail. Where do our proposals overlap and where do they differ? Nitya, perhaps you can start us off.
Yes. From my perspective, the most urgent problem is nutrition. I've seen diabetes patients given white bread and sugary drinks. I've seen nurses surviving on food snacks during double shifts. This isn't a healthcare, it's harmful. Without proper nutrition, recovery slows, staff get weaker, and hospital costs rise. That's why I believe nutrition must come first.
I agree with you, Nitya. Food is important, but may I challenge your points? I have met patients who refuse even the healthiest meal. But why? Because the patients kill their appetite and made it hard for them to eat. I have also seen staff skip food entirely, not because meat were not available, but because they were too stressed or overwhelmed to take the time to eat. This shows that mental health challenges directly affect not only recovery but also basic self-care. Without addressing this mental health issue, even the best nutrition plan can fail. So yes, nutrition matters, but if the mind is broken, the body rejects the solution. That's why I argue mental health is the real foundation.
I respect both of your arguments, but let me ask, why are we focusing only inside the hospitals? The truth is, half of Malaysians do not exercise once a week. Obesity, diabetes, and heart disease are exploding. By the time people reach hospitals, it is already too late. We must start prevention in communities. Otherwise, no matter how healthy the food or how strong the counseling, hospitals will stay overcrowded. Prevention saves money, saves lives, and keeps people out of the system. Don't you all agree?
I see your point, Lukman. Prevention is vital, but what about those already inside hospitals today? A cancer patient recovering from surgery cannot wait years for prevention campaigns, isn't it? They need proper meals now, not in the future. So I agree prevention helps long term, but nutrition is urgent.
Yes, I also agree with you, Lukman. Exercise also help build strength and coping skill. But right now, Malaysia is facing a mental health crisis. But more people are experiencing stress, burnout, and sadly, the number of it due to self harm is rising. So then telling a nurse on the worst of collapse to just exercise more, but it won't solve the problem. So she really needs counseling, empathy, and immediate emotional support.
I understand, and I don't dismiss the urgency. But if we only treat existing problems, we will always be one step behind. Yes, feed the patient. Yes, support the nurse. But unless prevention becomes part of daily life, the cycle repeats and the burden grows. We will find ourselves overwhelmed again and again. So my question is this. Why not strengthen both today and tomorrow, side by side?
I hear all of you and I realize something. None of you are wrong, but maybe the problem is this. You are working in silos. Picture this: nutrition, mental health, exercise. Each are being treated separately. However, patients don't live in compartments. They eat, they feel stress, they move, all in one day. Families practically experience all these together. Yet our solution sounds like three separate worlds. That's why I propose GenBridge 360, not to replace your programs, but to connect them all into one model. Instead of competing, what if we actually complemented each other? Now, while we can see the value of working together, we must also face the reality. The ministry is only going to fund one lead proposal. That means we need to decide whose program will anchor this partnership. So let's put it all on the table. Each of you make your strongest case or for why your program should take the lead. Nitya, let's start with you.
Let me explain my point. Okay, NutriCare should lead because nutrition is immediate. Every patient eats 3 times a day. Every staff member depends on me. As a normal human, we are giving very important for the food. And why don't we give the importance to the patients and the staffs? If the food is wrong, the system fail instantly. Our program addresses the most urgent visible problems. You can't chill on an empty stomach or with harmful food. Don't you agree urgency make this is a priority?
Yes, Nitya, I respect your urgency, but the truth is, even with healthy meals, a patient with depression may not eat. Also, a nurse facing burnout maybe skip meals. So, a mental health can be seen, but it affects everything we do. So our feed should lead because it focuses on the mind, which is the hidden base of our health. So I wonder how can nutrition work if the mind is not willing to respond?
You both make strong points, but I challenge this. You are focusing only on treating problems after they appear. Without prevention, hospitals will always be crowded. We will be patching wounds forever. GenFit should lead because prevention is the only long-term solution. It is cheaper, sustainable, and keeps people healthy before they suffer. Isn't the smartest choice to stop the fire before it spreads instead of just treating the burns?
Ikman, I hear you. Prevention is important, but let's be realistic. A cancer patient recovering from surgery does not benefit immediately from prevention. They need nutritious meals right now. If we wait for the long term result while ignoring today's need, we fail them.
Yes, true. Prevention alone won't stop a nurse from crying in the staff room tonight. It also won't comfort a teenager who is struggling with depression right now. That's why mental health needs urgent attention and immediate support, not just long-term prevention. I do agree that prevention is important, but when people are in crisis, they can't wait for future benefit, right? So they need help here and now, like counseling, cares, and understanding to get through the moment and start healing.
I agree with both of you. Urgent treatment is absolutely necessary, but without prevention, the future only gets worse. We will still face overcrowded hospitals, rising stress, and growing sickness. So yes, let's treat today, but let's also make sure we don't ignore tomorrow.
Once again, all of you are right. But if we are going to be fighting for leadership, three of us will end up being losers and only one will win. And Malaysia loses the combined strength of your ideas. What if, instead of fighting, we unite? Here's a compromise. Jambish 360 will serve as the lead framework, but within it, NutriCare delivers the nutrition programs, AuraFit provides counseling and stress support, GenFit pilots one fitness zone to prove prevention works. This way, the ministry funds one proposal, but all of you have ownership and visibility. What do you all think?
Yes, I can totally agree. If nutrition is given proper visibility and not left as a side dish.
Yes, good idea, Alicia. Good idea, Alicia. Thanks for that. As long as mental health is recognized as equal, not secondary.
I think that idea is gonna work. And my answer is yes, if prevention is included through at least one fitness zones. I don't want it lost in paperwork.
Then let's consider it done. We now have a consensus. This isn't just a compromise, by the way, it's a true partnership. Together, we're presenting one united solution that is stronger than any of us alone. This is a win-win solution for us, and most importantly, for Malaysia. Now, let's imagine the ministry panel is with us and they are going to ask us some tough yet important questions. The first one is, your budgets are high. How will you prove results within 1 year? Let's start with you, Nitya, followed by Diana, and finally Lukman.
Of course, Alicia. For NutriCare, we will track patient recovery times and hospital stay lengths. This means NutriCare, which are probably a healthcare or nutrition company or program, wants to monitor how long patients take to recover and how many days they stay in hospital. Faster recovery saves costs, isn't it? It's measurable. If patients recover quicker, they don't need to stay in a hospital as long. Am I right? Shorter hospital stays equal to less money spent on rooms, treatment, staff times, and resources. Because these are numerical days and costs, NutriCare can measure and prove the benefits of the program. In short, the statement means NutriCare will measure patients' recovery speeds and hospital stay duration. If patients get better faster, costs go down, and these improvements can be shown with a clear data.
At our feet, we will measure staff stress and burnout before and after counseling using reliable, easy to use survey. If we see a drop in the stress level, less sick leave and fewer staff leaving, it will show the program is working well. So our budget is higher because we are investing in trained mental health professionals, structured counseling session, and practical tools like stress assessment and self-help guides. So we also plan to train peer counselor to provide ongoing support. These costs are necessary to ensure lasting impact. So with the data that we collected, we will be able to show clear and measurable results within 1 year.
Meanwhile, for GenFit, we will prove results in two ways: participation and also health. We will track how many children, adults, and seniors join regularly, showing strong community support. We also will be monitored BMI and fitness levels in the pilot zones. Within a year, the ministry will see both engagement and better health outcomes. And Elisha, since you have worked closely on aligning our proposal with the fund's priorities, perhaps you can share how our budget is structured to deliver these results efficiently.
Definitely, Lukman. On the budget, we designed it with efficiency in mind. Every ringgit is tied directly to the outcomes. Equipped for the fitness zones, training modules for volunteers, and monitoring tools to track health improvements. Because we train local facilitators, costs go down in the long run. In other words, this isn't just spending, it's an investment that saves future healthcare costs by preventing diseases. That's real value for money. Now let's move on to the next question. How will you ensure this program is sustainable after funding ends? Nitya?
Yes, NutriCare plans to collaborate directly with the local farmers and food producer instead of relying only a large distributor. By doing this, lower costs, which is buying food locally, reduce transportations and middleman expenses, which help keep meals prices affordable for patients. However, fresh and healthy, which local sourcing ensures that the ingredients used are fresher and are higher in a nutrition value and better suits to local diet. Furthermore, support for a community, which is partnering with nearby farmers, boosts the local economy, creating a sustainable supply chain, reliable supply, and a strong relationship with the multiple suppliers, guaranteed a consistent food availability and even when a price fluctuated in the wider market. In simple terms, NutriCare will work hand in hand with local farmer and food businesses so patients get fresh, healthy meals at a lower price while also supporting the community.
So, for our feed, we ensure sustainability. We are focusing on building community capacity. So, we will train peer counselors such as former patient, caregiver, or community health workers so that basic mental health support can continue even without professionals. We are also developing culturally sensitive toolkits and also self-help materials that non-specialists can use. In addition, by working closely with a local clinic, school, and community leader, we aim to include mental health support as a regular part of existing health program. So this way, the support system became community driven and able to last over time.
In GenFit, we will focus on sustainability by training community volunteers to lead fitness sessions. These volunteers won't just conduct activities, they will also act as motivators and role models within their neighborhoods. Once the culture is embedded, people don't need to rely heavily on outside trainers or large budgets. A morning Zumba, weekly walking group, or a senior-friendly exercise circle can all be run by trained locals. This way, fitness becomes a community-driven routine rather than a project that fades when funding ends. In the long term, the program grows stronger because it belongs to the people themselves.
And Genbridge 360 ties these together. So sustainability is not separate projects, but one ecosystem. Now, to summarize, we have reached a consensus. Genbridge 360 will serve as the lead framework, with NutriCam, AuraFeed, and GenFeed integrated as equal pillars. This is once again not about one winner and three losers. This is about four leaders combining their strengths into one unified, stronger solution for Malaysia.
Thank you. I can focus only on nutrition, but today I learned food is just one piece of health. By linking with mental health and movement, our meal can create an even bigger impact.
Yes, correct. I believe in focusing on mental health alone, but now I understand that counseling is not enough. So nutrition and exercise are key to recovery and building strength together. They are more effective.
Today, I came determined to champion prevention, but along the way, I realized that prevention alone means little without urgent care for those who need it today. True progress comes when we collaborate, balancing immediate needs with long-term tech health.
And what I've learned today is that true leadership is not about winning at the expense of others, but about connecting strengths into one shared vision. That is how we move forward together. And with Genbridge 360 as the bridge, all of these strengths unite under one roof. If the ministry funds this integrated proposal, you are not just funding a single program, you are funding faster recovery through nutrition, stronger minds through counseling, healthier communities through fitness, and stronger social bonds through intergenerational connection. Together, these pillars form a complete ecosystem of care, prevention, treatment, and recovery, all working hand in hand. One ringgit invested here saves many more in hospital bills, absenteeism, and social care. This is not an expense, it is an investment in Malaysia's future. Together, we are stronger. And I believe none of us have any more questions, right? With that, can
Yeah.
end this negotiation. Thank you everyone
Yes.
for your participation.
Thank you,
Thank you,
Thank you,
everyone.
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 Thank you, everyone.